Good morning, everyone. Actually, behind my presentation today, it says questions. When pairing the word of pregnant with gingivitis or Pyogenic Granuloma. Also, I faced one case when I was internship. When I see this case, I don't know what it is. It's benign, it's malignant, what the treatment, and what the cause behind this tumor, if it is tumor. My name is Dr. Ahmed Shibli. Today I will talk about pyogenic granuloma. Pyogenic granuloma is a common tumor like growth in the oral cavity. Traditionally has been considered to be non-neoplastic in nature. It represents tissue respond to the local irritant or a trauma. Instead of me, it is not true granuloma. Let's move on to clinical feature. Shape, location, age, and size. According to the shape, it is smooth, lobulated, usually pendiculated or sessile, surface is ulcerated, it is asymptomatic, is painless. According to the location, the most common size for a pyogenic granuloma in attacking gingiva by 75%. A second most common size is from lower limb and buccal mucosa. It is more happen in maxillary gingiva more than mandible, anterior more than posterior, facial aspect more than lingual. When we talk about the colors of this region, it is ranged from the pink to red to purple according to the age of each agent. The young pyogenic granuloma is more vascular due to the predominant of the granulation region, and the capillaries is more prominent. So, more old region is pink and granulized. According to the size, it is varying from the few millimeter to the several centimeter. According to the age, it is occur in any age, but in many studies I read there are found it's more prominent in second decade of life, more in female more than male. Why in more female? Because the vascularity effect of the female hormone is more. Also, it's happened in the pregnant woman by 5%. Why? Because during the pregnancy progress, estrogen and progesterone hormone is more increased in the level. So as we say, in this picture, the pyogenic granuloma is more occur in anterior facial aspect of the mandible. So let's go to the cause. Extragingivally, it is related to the history of the trauma for the patient. Also, the gingiva for irritant, most individual with chronic oral irritant for overhand restoration and calculus. Also, for oral hygiene, it is predisposing factor also for pyogenic granuloma. Hormone change, as I mentioned, for pregnant women and female. Also, many studies, they reported many cases that many drugs that induced pyogenic granuloma such as cyclosporin that we use for like rheumatoid arthritis or organ transplantation. For diagnosis, when a mass is found in the oral cavity, it's important for further evaluation and formulated differential diagnosis for further evaluation, condition, and management for the patient. Also, the biopsy's finding is a very important role for definitive diagnosis. So many differential diagnoses for pyogenic granuloma, such as peripheral giant cell granuloma or peripheral ossified fibroma. For peripheral giant cell granuloma, it's look like seen exclusively seen in the attaching gingiva, also according to the color. The pyogenic granuloma is more light into the red in color. Also, pyogenic granuloma, peripheral giant granuloma, it is more causes bone resorption more than pyogenic granuloma. So, exogenal biopsy, it's along with histopathological evaluation is important. Surface is usually ulcerated and replaced by thick fibrinolent membrane. Surface was hyperplastic, paracaratinized, stratified squamous epithelium histopathologically. After we got correct diagnosis, let's go for more important part, the treatment. What's the treatment? There is many treatment option. It is described for treatment pyogenic granuloma, such as exogenal, surgical exogenal. But sometimes its cause is many deformities is in many patients. Sorry. Also, the treatment is depending on the symptom of the pyogenic granuloma, such as if we have the painless, free bleeding, and asymptomatic pyogenic granuloma. So observation, it is one of the treatment option for this patient. Also, according to the conservative surgical excision, it usually is important, such as that and calculus remove of foreign material and source of the trauma. It's usually is a treatment. Also, for excision, when do excision should be extended down to the periosteum and adjacent teeth that should be removed, scaled and remove any source of continuing irritant. Also, there is many studies show the uses of the Nd:YAG laser. Nd:YAG laser have more properties and more painful than excisional biopsy that did not more creating a scar due to the coagulation characteristic. Also for pregnant tumor, for pregnancy tumor, during this period, maintain good oral hygiene and remove the plaque and calculus and maintain use soft brush. It's very important in this period. But if there is any functional or aesthetic problem is arranged, so this treatment should be accomplished if it's possible in second trimester with with home care. But many doctor and many research decide that for prevent any recurrence of these pyogenic granuloma or for successful treatment, it should be awaited for until perioration. So the recurrence, yes, there is recurrence and there is many reported. The recurrence is up to the 16% due to incomplete excisions or failure to remove etiological factor or re-injure the area is again. So pyogenic granuloma, it is non-neoplastic growth in the oral cavity, proper diagnosis and treatment and prevention, it is very important. Thank you for your attention.
Thank you.
Thank you.
Good presentation. The topic also interesting. There's many cases we see in the clinic that in all the symptoms. Symptoms becomes very pregnant there, no? And we face daily that kind of tumors in our population. The hygiene is not properly with the Ahmad Taban.
لا أنا سكرته.
Any comment?
بس دكتور في كومنت بسيط. في كومنت بسيط. في الستديز الجديده اللي جالسين الحين النيو ستديز اللي جالسين الحين يناقشوها for treatment of granuloma في شغلتين تو ثينكس. الشغله الاولى بعد الاكسجينال بايوبسي او العمليات ليزر علشان ما يصير عندهم الاشكال فورميشن خاصه اللي هو مثلا اللي هو ننزل الريشن اسبكت فور اسيتيك اريا او اسيتيك فود، صاروا يستخدموا شغله اسمها injectional absolute ethanol and also الكريوسيرجن. طبعا الايثانول انجكشن طبعا هذه هي superior، هي الافضل لانها ما تسبب اشكال واقل bleeding also post operative يكون less pain when compared to any surgical or any treatment option that doctor or surgeon he would do. Even cariosurgery, it's more used according to the humidity or smoothness or the location. So according to the location of the Pyogenic Granuloma, now the treatment is decided.
I think my question is that scenario for recurrence, but in the end, she got that clear the question.
Yes.
But this it really is a current step. How do we know the excision is complete or not? That's my question.
What doctor?
How we know we did the incomplete excision or the excision is complete? Slide.
Yes, incomplete excision.
How we know? How we know that incomplete excision? How we know that complete or not? Or not?
According to the border of the lesion, if I remove all the border and I go more to the periostom, as I mentioned.
The tumor itself never becomes hanging like that.
Yeah.
It becomes sometimes it's deep.
Yes, go deep to the periostom. Yes.
And roots.
Yeah.
It's difficult sometimes to go there. I think we have to create establish that properly. Till there is no bleeding, because this access bleeding.
Yeah.
No bleeding. Because that cells, if there is remaining cells, it become
Bleeder.
recurrent.
Yes, right.
And you are not solved in that situation, the bleeding is there. Patient is not happy because go home, bleeding there, whether you are not solved anything. Anyone want to add?
Yes, and for example, the clinical presentation is very characteristic, right? Most likely that he has it and it's has a specific force, right? Most likely in the region of the anterior force between the time. What if you go to the X-ray and there is bone growth? This is called Pyogenic Granuloma. Well, there's differential diagnosis for this lesion.
More. يعني too much differential diagnosis such as also
So
Kaposi
you always have
sarcoma.
to think, whenever you think Pyogenic Granuloma, you have to think about central and peripheral glandular granuloma because they need to see.
Yes.
And that's good with the name center because the differential diagnosis between central and then if you go and you operate a central granuloma and you are not feel that pyogenic is varying this.
Yeah.
The only way you can tell this is pyogenic granuloma is after you receive the histopathologic report from the lab. Other than that, we can suspect it's pyogenic granuloma or central granuloma. So they're all of the same.
So all of the granulation tissue.
Or even previously, there's some people pregnancy.
تمام some add more head. اوكي تمام شكرا دكتور ثانك يو. احمد ايش موضوع الروتيشن هيد؟ روتيشن معنى يبدا بعد بيطلع شو يعني؟ تمام نحن على اساس ما نريد نسترك فيو السنتر يعطينا في كومبلين انه ناكل الخميس وفي تاخير موظف يفضلوا وكذا وما حبيت نعمل بعد التقييم الليكتشرز اللي بيصير عند الدسكشن كيس حسيت انه مش يوزلس ولكن الكواليتي ماله مش الى حاجه
الجرد منهم. فقلنا نعطي الفرصه وهكذا نستفيد من هذا الشيء. وبما انكم عندكم في روتيشن شهر صح مع احمد؟ والله يكون شويه متعب لانه عندنا بلان لكل طبيب جاي عندنا وما يعتبر انه في دوله